So is cybersecurity something you're just curious about personally, or is that something you may considering making a career change?
Yeah, it's actually more of a personal curiosity and how it works, and part of that is because the project we're working on is related to healthcare, and so I wanted to understand the broader picture of how it might fit into it as a whole.
Okay, so in healthcare,
in terms of patient data and things like that.
yeah, so you definitely have to be focused probably more on the compliance side. Although there's also data security concerns, but really HIPAA and compliance, isn't really security. Insecurity isn't really compliance. Although they do work well together and have a relationship, right? So, do you have any specific questions related to HIPAA security, or HIPAA environments and securing the patient records or anything like that?
Nothing specific, actually. It was just more of a general curiosity and how that goes about. But you also said you mentioned different previous people in startups and such. And so I just wanted to hear about that experience and, see if it makes sense to be part of each other's ecosystem.
Yeah, when it comes to information systems that are in healthcare, a lot of companies today, especially if they're not mature and have limited budgets, they're going to be very focused on just being compliant and not really truly being secure. I try to help organizations that work in healthcare to try to be both within their budget. So I try to use more modern tactics and that are not only going to meet the HIPAA compliance, but also meet some modern security best practices and improve their security posture, right? So I try and focus more around securing the data throughout the whole life cycle, no matter where it is, and then two, on the access controls. And that's mostly because today, the number one thing in the old days in security used to be disaster recovery and business continuity. But now with virtual machines and cloud, it's so much easier to do than it was 15, 20 years ago. And usually what I see is that's the responsibility of the business unit or IT operations, not really security anymore. So I tend to focus more on securing the data throughout the life cycle and the access controls, especially within the cloud, just because those are the areas that you have the responsibility as the customer or the user of the cloud environment, and the weaknesses in those two areas are going to lead to breaching your patient records.
Okay. And how do you see that being affected in terms of, the Apple is trying to do more patient-centered data, so in terms of like patient control, and I feel like that is going to open up a lot more complexity in cybersecurity, especially when the end users is going to be so many people, and then the interaction is going to be so many people, right? You don't have to depend just on doctor and doctor interaction. Now you have exponential potential for interactions between patient and
yes, more patients means more records, right? Means bigger databases, but the technology seems to be keeping up with the times, and the processing and storage power is keeping up with the times. I think in 5 years and 10 years from now, using big data, using blockchain to manage healthcare records is going to be a lot more common. I think I just read the other day in Wire magazine a survey from Deloitte, a research paper that they did. I think there's a country out there that's using blockchain to manage all the country's health records so securely So if you're a pharmacy or a doctor and you go to another doctor, you don't got to fill out the same forms over and over and over again. I think if you put your mind to it, you can do anything. Just like anything can be breached, anything can really be secure if you have enough resources, right? And if
That's true.
so,
Yeah.
it really just comes down to resources and how much effort people want to make. There's a lot of interesting ways to secure patient records or any record. There's a lot of cool whole life cycle data protection solutions out there, and access management and identity management has come a long way. What I see is not a lack of capability; it's a lack of will. Security in most organizations is a business operation issue. It's not a technology issue. The technology is there. It's just how much resources or how seriously does the organization want to take the issue.
Okay. Yeah, that's really interesting.
Yeah. Now, the thing that I think it's improved a lot in the last 2 years, but if we're talking about security in healthcare, one of the biggest concerns is just the IoT type of devices in hospitals and clinics, right? You got a lot of things that are not only watching people, but are also inside of people that are connected to Wi-Fi and through Bluetooth and other wireless protocols that technically could be hacked. Just like people started building automated cars and didn't think about security. And there's technically ways out there for you to kill someone through those devices if you were to hack them. There's like insulin pumps and all kinds of things out there that you can control remotely. Now, I think when I was talking about security, there's a lot of solutions out there. I was talking about the enterprise level, but when it comes to some of these other IoT type devices that you see in the medical field, security and IoT, I think people today understand it's an issue, but it still hasn't been correct. There's companies out there, individual companies that might make IoT devices that take security more seriously than others. And I think the medical field is taking it more seriously. I've seen CISOs and CTOs talk about it. But that's definitely a huge issue that the technology, especially on the manufacturing side, hasn't really caught up with.
Okay. Yeah, that's really interesting. Thank you for that. I just wanted to connect with you. It seems like, it's definitely something that I'm not used to and I don't get surrounded with. So I wanted to kind of pick your brain. So I really appreciate your time in sharing that.
No problem. So you plan on using this kind of information to help your clinic or hospital in some way?
Well, I think it's just more of a bigger picture, as we're diving into the patient data and information.
Yeah.
I wanted to be able to understand what people are kind of talking about and what is on the horizon, and not have us be caught by surprise, right? And so as we're, as a startup, we're going to be accessing patient information.
Yeah.
Right, and that type of stuff. And so we want to be able to answer to hospital systems or service centers those concerns if it does come up.
Yeah. Yeah, and when it comes to, I've worked with a lot of hospitals, and they tend to focus on some things that I tried and haven't refocused. Identity and access management everywhere is a big priority. Where they tend to see resistance is some of the more modern ways to secure the data, no matter where it goes, is a very long and resource-intensive process. And if you have also a huge internal team that's building custom applications and information systems, it changes the way they do business. So it's a huge culture shock. Kind of like in the old days when you have to, or when a company's going from maturing, going from entry-level enterprise to a senior enterprise, and now they got to do formal, maybe project management, change management process, and people resist. When it comes to whole life cycle data security, it's a huge change. And so I see a lot of companies wasting time and resources buying different platforms to secure the data in different areas, but there's still gaps in the whole life cycle. And all those different platforms require a different license, different full-time employees to manage or outsource. So it's not only more secure, but also more cost-effective to use a more whole life cycle type solution. And there's still when it comes to a lot of security, more of the modern next-gen security, some people resist it, except for the more sexier things that are maybe like a next-gen firewall or some of the AI hunting on a SOC. Some of the other things that are more complicated and resource intensive tend to have a negative light on the culture.
That makes sense.
Well, I'm glad you reached out to me for some security knowledge. Feel free to hit me up on Twitter or also check out my show, Sec Talk with DerlyG on YouTube.